good morning, good afternoon, good evening, good, all the good, depending on where you are joining my life from, okay? So today, as I promised you the last time, I said I'm going to teach you guys how to use suppository for candida infection. A lot of persons are having candida. Some persons, even after seeing their menstrual cycle, the next day is candida, scratching, itching. Like most persons in my video that I said the best drugs to use for candida infection. That was one of my video. A lot of persons don't know how to use suppositories. They were asking how would they use this suppository? Is it good for pregnant women or not? Okay, they were asking a lot of questions. So right on this video, I want to teach us how to use suppository, and also I'll teach you the drugs that you can use for candida. Okay, so please, I would like people to join me. Everybody come join my life. Even though you did not join me live now, you can still just go and check and watch the video. Okay, that is it. So the one that I made for that video, that was how to use the best drug for candida infection. Okay, in that video, that live, that video, that drug that I put, that was and this it's not clean fat. I added one drug that I had put there. That drug is very good. It's safe for pregnant women and those who are not pregnant. Okay, it's safe all around. Okay, that is clovina. Yeah, clovina. I've gotten it. So that was clovina, because clovina contains flagyl, metronidazole, and clotrimazole, also, which is very good for pregnant women. Okay, so I could not get hold of that one, so that was why I brought this one. Okay, this one is clean fast. This one too is very good for everyone, but it's not actually that good for pregnant women, because the antibiotics that are contained here is not good for pregnant women. Okay, so if you are not pregnant, please, this is very good because it contains 3 antibiotics. It contains 2 antibiotics, and also it contains antifungal. So this is meant to be inserted. So when you see suppositories, drugs that they wrote suppositories, they are either meant to be inserted into the vagina or into the anus. Okay, so when you're seeing vaginal suppositories, it means that they are meant to be inserted into the vagina. Okay, so this is the drug. Now look at it. This is the drug, the plain fast. Okay, and this is the tube that you are going to use for insert. A lot of persons don't know how to use this, this thing and this drug. That is why I'm doing this video. Yeah, this video is to teach you how to use your suppositories. Okay, this is the suppositories. Look at what it contains. Yeah, if you can see it well. It contains clindamycin, clotrimazole, tinidazole, suppository, vaginal suppositories. Okay, so it's written like that. It means it's vaginal suppositories. It means you have to insert it into your vagina, not your anus. Okay, so this is for that. Okay, then I know a lot of persons, you see this paper inside, always try to read what you can in this paper. Okay, this is quite big, but this has all the procedure and everything, because the therapeutic form, since I said it contains antibacterial, because sometimes you might be having misinfection. Okay, that is why I brought this one in particular for those that don't do not go out to carry tests, but they don't know if they're having misinfection or just one infection. Okay, so if you're having mixed infection, it means that you're having fungal and bacterial infection. Okay, so you need to use one like this. If you not go and do test, you don't know. But if you do test and you know that it's just candida, you can just use plain clotrimazole. Okay, so this one contains bacteria and antifungal effects. That is for this clean fast. Okay, yeah, so you can use this one effectively for that candida infection. Please, ladies, I'm telling you, I'm not promoting the brand, but I'm telling you what to use. Okay, so that you won't say I did not show you picture. I've showed you picture. This is it. This is what you are going to use, and this is how the tablet is pinky. Ladies and pinky, it's pinky. Okay, that is it. And this is the insertion tube for the insertion. Okay, so now let's go dive in on how to use this suppository. Okay, I'm going to open one and I'm going to do the practical. So how to use this suppository is kind of simple. Very simple. All you need to do is focus on it, and you will know that it's very simple on how to use. Okay, The first thing is that this drug is used for 7 days. You can see it. If you can get the drug, you will see where they will write 1, 2, 3, 4, 5, 6, 7. It's even written on the body. If you can see it very well, you are seeing the numbering. It's numbered on the body. It's used in the night. You don't use it in the daytime. It's used. Suppositories are used in the night so that you won't move about and the thing will not fall out. I mean to say, because they are inserted into the vagina. Okay, so you use it only at night. Each night you're going to use it for 1 week. Each night is one for 1 week. Then after 1 week, even you said, you say before even the 1 week set, you say the itching, everything is gone. Okay, so don't be surprised. That is how they use suppository. Okay, let's don't mind noise or anything. That is how they use the suppository. So this is the insertion tube. The applicator, we call it applicator. Okay, what you use to use in application. I know some persons might say this thing it doesn't used to enter them easily, but I used to say if this thing cannot enter you easily, rub it Vaseline. Use Vaseline and rub on the body, then you can easily put it into your vagina. Okay, so the first thing you need to do is, while using this thing, is please, you need to wash your hands. Wash your hands. Bathe very well. Bathe properly. Okay. Bathe properly, or you wash your hands, or let me say after bathing you use this. Okay, don't go and use this when your hands are dirty. No, wash your hands, then you take one tablet of this, then you insert it inside there and you put it into your vagina. Okay, so the best way to place it into your vagina is you just lie down, your back facing your bed, then your legs will be a bit raised, like into your raise your leg up into your body, like those persons that want to give birth, like how they used to place themselves. Yeah, that is how you're just going to place yourself on the bed, and this thing is going to pass easily without even you rubbing your Vaseline or anything. Okay, so it depends on how you place your body. That shows how this thing is going to pass through your body easily or not. Okay, so just lie your back down. Lie your back down, raise your legs up like as if you want to give birth, then you take the drug and you put it. Okay, now let's show you how to use this thing. Now look at how it goes. Look at it. Look at it. I'll push it out. I'll push it in. You see, I don't know if you're hearing this pap sound. Paps. Okay, look at it. Yeah, that is how the drug is going to go into you. That is the sound. Okay, so now this thing now is to put the drug inside. Place this drug inside like this. You open it, place it inside, but first you will drag it out. You see, drag it out, place this drug, then you hold it, place it into your vagina, then you what, push it inside. So when you push it inside, before you hear that pop sound, it means it has entered. Okay, so let's do practical example now on how to put the drug now. So now let me say I've washed my hands, I've bathed. Okay, my hands are neat. I open the drug, look at it. Okay, so look at it. I've pulled it out. So I'm going to gently put this drug inside there. Look at it. Look at what I'm trying to say. You see now? You see what I was trying to say? I've gently put the drug inside. Look at it. Look at it. So now, what the next thing I'm going to do is, now I've gently put my drug safely into it. Some people are asking, will the drug enter totally? No, the drug and the mouth are made to be so. Okay, so now that you've put it like this, the next thing is to lie flat, your back flat, raise your leg up, then look at it. It's not going to fall easily because like I've put it tight. See, it's not going to fall easily, so don't be scared. What is going to push it out is this thing that you're going to press now. That is what is going to push it out. If you can just see how it is, you will notice that there is something that is about to push it out now. So you see, but now it's okay. So you lie down, fix it, then you put it down in your vagina. You put it down in your vagina. Then when you put it in your vagina, you push it out like this. Look at it. Okay, let me say I've pushed it into my vagina. Look at it. I want to push it out now. Look at it. Okay. See, you see how it fell. You see now, this is how it's going to enter into your vagina. Look at it, the thing is out. You can see it, it's out, to show you that that is how to put it. It's as easy as ABC, because a lot of person have been asking, how am I going to insert it, how am I going to put it in the vagina? So this is just how it is. Easy. You just push it, put it inside, push it. Look at it. Pap. Look at it, and it's going to fall inside your vagina and do its work. Okay, it's going to fall inside and do its work, giving you that relief. I think it has fall off. Okay, I think it has fall off. So it's going to fall inside and give you that relief. Okay, so this is how to use the applicator. This is called the applicator, and these are the drugs. Okay, this drug, as I've told you, it contains 2 antibiotics and antifungal, and the milligram it contains is so adequate, so good that it clears like ASAP. Okay, so this is it, clean fast, and how to use it. Okay, today I've fulfilled my wish. Let's say, no, I've fulfilled my promise. Now I promise you guys, I'm going to teach you how to use a suppository, how to insert a suppository. So I've taught you how to insert a suppository successfully without you asking anybody again. So this is how you're going to insert your suppository successfully. Okay, so you firstly wash your hands, or when you want to bathe, you take your applicator, open it, you put it. So after using the applicator, please do well to wash it very well, rinse it, and keep it back safe. Okay, because you don't want reinfection. Okay, keep it back safe. Put it inside the pack. Put it inside the pack with your drug, and you place your drug in the refrigerator, because suppositories like to melt a lot, so you can keep it in the refrigerator. But this type is the type that you can also keep at your room temperature, but not in a place that is hot. Your normal room temperature, you can just keep it there too. It's gonna be fine. Okay, if you don't have lights and the stuff, you can keep it in your room temperature and it's gonna be fine. Okay, so that is it. After washing your hands, as I told you, you take the drop, put it in the hole, you lie flat, your back facing your bed, raise your legs slightly to your body as if you want to give birth, then you push it, shake it inside, and it's always in the night. You don't have to do it in the day. You do it in the night and you sleep. When you want to sleep, you do it and you sleep. Okay, that is all about it. So you can still go and read the leaflet on direction of use. That is it. But if you notice that you are having some irritations, or you are feeling not so well with it, you can discontinue the drug. That is it. But it's good that you complete it for 7 days. But I doubt if any person will have any irritation, because it's highly not expected to give you any irritation. So in the pregnancy, is not used for pregnant women. I've told you before, is not used for pregnant women. Okay, in the first trimester of pregnancy, is not used. So if a pregnant woman wants to use, they can use the clovinal. They can try out the clovinal. Okay, the clovinal does not usually have this tube. The clovinal does not have this applicator. Okay, but they used to sell these applicators separately, just 200 naira now. 200, you can easily buy the applicator and use it. That is it. So any person that comes to me that is pregnant, I used to give the clovinal, then I'll just put this tube, because it's 200 and the person is good to go, the applicator, and the person is good to go. Okay, so if you are pregnant, you can use the clovinal. It's safe for you because it contains metronidazole and the clotrimazole. But this one contains other type of antibiotics that are not safe for pregnant persons. Okay, so it's not safe for pregnant person. You don't need to use it. That is it. Okay, so it has this antibiotics that is even good for ulcers, duodenal ulcers. Yeah, this is also even good for duodenal ulcers, because it's containing these 2 antibiotics, these tinidazole and clindamycin. They are good management for ulcers. So because those that have duodenal ulcer, that used to have bleeding, black bleeding, duodenal ulcer, they can easily use this too. Okay, and it should be good for them. Okay, so this is vaginal suppository. It's going to clear that your infection, that your candida fungal infection, that your candida fungal infection is going to clear it ASAP. Is very good for candida infection. Okay, all those people that used to have these smelling discharge that is so thick and colored, like sometimes yellow, sometimes brownish discharge that is not good, and you know your down is smelling, please go and get this one. Go and treat yourself for infection. Yeah, but you can try out this and other antibiotics too, but this is very very good, effective for infection. Okay, so today I will say I will teach you how to use suppositories. So this video now, I've taught you how to use suppositories, and I've used time to tell you the best one that you can use for your candida infection. There are several of them. Oh, please, there are 1 million of them, but the one that are around my area, my state now, or the ones that I'm seeing now, the combinations and everything that I'm seeing now, this is the one I'm seeing so far and so good. Okay, there are other expensive ones and other good ones that I can try too. So that is it. Okay, I think I'm having 11 person that are following me. 11 persons are following me. Thank you for joining my life. Thank you for joining my life, everybody. I know a lot of persons have learned something today, because how to use this thing is not easy. Questions that come with it, patient will go to still come back and tell me fam, it's not working or it's not this thing, but today is just free lecture. So I told you, if you know that the friction is not allowing it to enter, just use Vaseline on it and it will be easy to go. Okay, thank you for following me. Thank you guys for joining my live. Thank you everybody. We are going to be doing more of live, you know. Any question that you have, just be dropping it in the comment section, so that if you want me to join you do live, you can just do live, you know, and we'll talk about it. Okay, that is it, that is it, that is it. Yeah, thank you guys, we'll see you in our next live. Bye. Yep, 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 yep. And done for the live.